All right. So my name is Sklyer Manney. I am a social worker here at FirstLink. I've been here for about a year or a little over a year now. And I'm the Community Engagement Coordinator. So I spend most of my time talking to people in the community, training professionals in suicide intervention, and just getting our resources out there for everybody. So today we're going to talk a bit about what FirstLink is, the services that we offer, and how you can reach us. So, just a bit about FirstLink. Our mission is to assist people in identifying, accessing, and making effective use of community and volunteer resources. FirstLink has been around for over 55 years, and in that time, our mission has really changed from more of those volunteer resources to now those community resources and connecting people to different agencies that can help them. And our vision is where our name comes from. So our vision is to be the first link in linking people and resources 24 hours a day. So connecting people to places that can help them and resources that can assist them. We do this through a few different ways, but our foundational services are the 211 helpline, which is information to local community resources and offering non-judgmental listening and support. And then our 988 Suicide and Crisis Lifeline, which is support and crisis intervention for anyone experiencing any sort of mental health challenges, not just thoughts of suicide. So throughout the state of North Dakota, we have some other contracts as well. So we support all of the human service centers or behavioral health clinics, as their name just changed to, by answering their phone after hours. This relationship also allows us to dispatch mobile crisis teams if that is ever needed. So having a professional from the clinic go out into the community and meet somebody in crisis and do an assessment and talk to them and kind of figure out next steps from there if maybe an interaction over the phone isn't doing what it needs to and we need some face-to-face interaction. We also have our care and support program, which is FirstLink's follow-up service. So we're offering support provided to anyone in need, reaching out regularly to offer resources and a listening ear. So we'll talk more about the care and support program later. I want to make sure. Yes, okay. So I won't get into it now. Oops. And then we also offer mental health education. So if you're interested in learning more about suicide intervention skills or suicide risk assessment, we have a lot of trainings coming up on our website. So you can check those all out there. And they are approved for CEUs for a few different boards. So if you do need continuing education credits, you can get those from our trainings. And they're also free right now, thanks to a few different grants that we have. So the main differences between 211 and 988. 211 is statewide for North Dakota from FirstLink, and then we also answer for Clay County, Minnesota, just because of how interconnected Fargo-Moorhead area is. And then because we know it's important to get to local resources and talk to somebody that's local, there might be a hold time if you do call. It is very rare that it is, and it's usually just a few seconds. But we want to make sure that you're getting connected to somebody local. Where with 988, they work to make sure that no call is going unanswered and nobody has to wait longer than they need to. So if somebody at FirstLink doesn't answer in 60 seconds, those calls are getting sent to a national backup center to be answered as quickly as possible. Now, every once in a while, they will have a hold as well. So if that ever happens and you don't want to wait, or if you're with an individual that's in crisis, you can always hang up and try calling back again. And maybe then somebody at FirstLink will be off of the phones and somebody will be able to take your call again. So for 988, we answer for all of North Dakota and then 17 counties in Minnesota along the Red River. And we answer calls, texts, and chats. And again, we're offering crisis intervention and safety planning for those struggling or their loved ones. So all of our phone lines are 24/7, 365 days a year. We don't close here. Our admin offices do, but our phones never do. They're all confidential, so we keep all of their information private, and we're only breaking confidentiality for imminent risk of harm to self or others. And we're providing non-judgmental listening and support on both of these lines because we know how sometimes emotional and how stressful it can be if you're in need of different resources like rent assistance, so you don't have enough food on the table, and what an emotional barrier that can be as well. So we're here to support people through those situations. So when you call 988, you're going to go through, well, actually, first we can talk about both lines. Both lines, when you call 211 or 988, it's going to have a brief automated greeting. On 211, it's just going to have you press 1 to be connected with local resources, that which is just kind of to filter out spam calls or anything like that. With 988, it's going to be about a minute long for a contact tree. So it'll be ringing, and then it'll say, you have reached the 988 Suicide and Crisis Lifeline. For Spanish, press 2, and they'll say it in Spanish. And then for veterans crisis support, press 1. To be connected with a crisis specialist, please stay on the line or press 0. So if you're with a client or somebody that you're working with and you just want to skip all of that, you can press 0 and it'll just start ringing to FirstLink. Yeah, do you have a question? Oh, you're muted. I'm sorry.
What about other languages?
Yeah, so FirstLink, I was just going to say that I like to go through all of the options first. So FirstLink has access to an interpreter service with over 170 different languages. So we can support pretty much any language that we've come across so far. They just have to call. We're not able to do that over text or chat. But if you call on 211 or 988 and get to FirstLink, we can pretty immediately get that interpreter service included in that call and support that individual. So after that greeting, the 988 one is really long. It's slow for people in crisis who might have that increased processing time. Sorry, did you have another question? Okay. That increased processing time during crisis. And then it'll say, like, you're not alone, please stay on the line. And then during that time, it'll be ringing at FirstLink. And so once we pick it up, we will say something like 988 crisis support line, this is Skylar, and then kind of just go from there and really be led by your situation and what you're going through. Now on 211, we'll answer the phone. FirstLink 211 helpline, what zip code are you calling from? So by getting your zip code, that allows us to find resources that are applicable to your area and make sure that we're only finding programs you're eligible for. And then while we're kind of hearing your situation and your story and what your needs are, we're going to be figuring out how we can best support you. So that might be offering you resources, whether you're calling for resources or calling for emotional support. We might be offering you resources. We're able to do all of that on both of our lines. So even somebody calling on 988 could apply for rent assistance through the CARES program with us because it's the same people answering both lines. We might be working on crisis or safety planning and de-escalating that situation, or different crisis intervention options like mobile crisis teams or crisis stabilization units, just depending on what that individual's needs are and kind of where they are in the situation as well. And then we may ask if we can send you information about what we talked about. So in a text or an email, we can give you the resources, or we can give them to you over the phone if that individual would prefer. We might also offer our care and support program, so reaching out 24 to 72 hours after this contact was made, and then doing another kind of assessment on your thoughts of suicide or what maybe substance use concerns or other mental health concerns that this individual might have, doing an assessment on that, and then offering to reach out weekly, bi-weekly, or monthly the next time, so we can keep following up with this person. All right, so we are going to talk about a little bit more about what specifically happens on a 211 call. So to reach 211, you can dial 211, or if you are on like the border of Clay County or out of state but looking for resources for a client who is in North Dakota or Clay County, you can call our 701 number, and that is going to ensure that you get to FirstLink and you're not routed to a different 211 center because it is a national program. You can also text your zip code to 898-211, and that is going to work all over the country as well. So if you're looking for resources in a different area, you can text that zip code to 898-211 and be connected there. You can also visit our website, which is myfirstlink.org. And I will show you how to access our directory of resources online, which is available for everyone to use. But on the phone, we are providing information on community resources, but we're also hearing the story and determining needs and eligibility prior to making any referrals. So sometimes somebody's calling and they are thinking they need one resource, but we're able to actually bring in all of these other resources that maybe the caller didn't think of or it didn't even know to ask for. And then we can make sure that the person is eligible before we're providing these resources for them. So we're not sending people on a wild goose chase as much as we can help it, but we're really making sure that we're providing applicable resources. And supportive listening, like I said, and in some cases, especially in the FM area, we're able to start intake for these services, like the CARES Homeless Prevention Project. All right, so this is our website. This is just the landing page when you visit myfirstlink.org, and it's going to say search for resources. And then if you click view, it'll bring you to a page that looks like this. It looks a little bit different now because we've changed our systems and I just haven't updated this PowerPoint. But it breaks it down by category. And then if you click in them, it'll be subcategory as well. So if you were to click on the housing one, it would probably break down into rent payment assistance, rent deposit assistance, household maintenance assistance, things like that. And then you would be able to click down into those. Be sure to put your zip code at the top where there's that zip code area. In there, you can also put your city, but wait for the suggestion to pop up. For some reason, that works better. I'm not quite sure why. You can also search for key phrases, but I think it's easier to just use the categories and subcategories and kind of break it down that way as well, because we do use kind of some weird coding words for these different resources. And then once you get to the subcategory of need, it'll show all of the resources in the area that provide you this need. Sometimes it'll zoom out really far if there's a national program that can assist, but typically it'll center you in on the zip code that you provided. And then all of these listings will have all sorts of information like their programs, any eligibility requirements, fees that they might have, if you can walk in for an appointment or if you have to call ahead, any documents that you might need to bring so that person can be prepared before their first visit, their address and contact information, hours of operation, all of that fun stuff. And then from there, you can text, email, or print all of the information right from this website so you don't have to have like a secondary brochure or binder that you're giving out. You're able to provide all of this information to your client or yourself. All right, so moving on to 988. You can call or text 988, or if you're more familiar with the National Suicide Prevention Lifeline, you can use that number as well, and that'll be routed to 988. You can also chat online at 988lifeline.org/chat. So for individuals without cell phone service or without a cell phone, they can chat online still with us if they're at the library or wherever. I also like youth to know this with the cell phone ban in North Dakota. Oh, I suppose you probably don't serve a lot of people in North Dakota. I present a lot more in North Dakota than I do in Minnesota. But with the cell phone ban in schools, it's useful for youth to know that they can still reach us if they don't have a trusted adult in school and they need to talk, they can still reach us using their school device. And on these lines, we are offering confidential, non-judgmental support while always encouraging appropriate professional care. We know the limits of what we're offering in this one phone call or text or chat, and we know that that's not going to help this individual completely through a crisis, but we can get them through this tough moment. So we're always going to try and set this individual up with counseling or therapy or somebody in their life that can help them moving forward. So maybe that's asking questions during our safety planning about, are you comfortable talking to a school counselor? Do you have like a doctor that you trust that can maybe help you find somebody to work with you longer on this? So we know the limitations of our work and we always encourage people to have other supports going forward. All of our call specialists are trained in assessing risk and effective safety planning to de-escalate mental health and suicide crises. So we go through a lot of training to be able to do this job. And we are very good at what we'll do. I'll show you on the next slide. Another cool thing that not a lot of people know that we do is handling third-party concerns. So if you are concerned about somebody in your life, but you don't necessarily know how to have that conversation with them, you can call 988 and we can help you through a few different ways. So one option would be to provide resources for you for how to help this individual. So maybe that's connecting you to a local mobile crisis team or a local emergency room so you can get an assessment done, or a different clinic that would do walk-in assessments, things like that, to help that individual that you are concerned about. We can also communication coach you and empower you to have that conversation with them, kind of give you some tips and tricks for having that conversation. And lastly, we can reach out for you. So we would get the name and the phone number of the person that you're concerned about, and then call them 2 times in a row. If they don't pick up, we would call you back just to let you know that they didn't pick up. If they do pick up, we would answer the phone. Hi, my name is Skylar. I'm with 988. Someone in your life is concerned about you. Do you have time to talk? So we would keep the fact that you had that concern completely confidential as well. And we would also not call you back to let you know that they answered, so we can keep their information private too. But that's just a really great resource for, we use it a lot with youth who are concerned about a friend but don't know what to do, don't want to get the police involved, don't want to get in trouble by telling parents or teachers, whatever it is. So they can call 988 and we can help them through that crisis situation that their friend is in. Again, we have those specialty lines like the Veterans Crisis line and the Spanish language line. We don't answer those, but we are more than well equipped to support anybody within those demographics, especially with our interpreter service that we have. All right, so just some stats to prove how good we are at our de-escalation rate over the phone. Last year in 2025, we took 88,004 calls, texts, and chats across all of our lines throughout the entire year. Of those, 19,806 of them were on 988 lines, so calls, texts, and chats on 988. And every year since 988 switched from the National Suicide Prevention Lifeline in 2020, we've seen about a 50% increase each year since then of people reaching out, which sounds like it's bad, but I promise it's not. It's just that people are recognizing the number and they are more willing to reach out and remembering to reach out in crisis. So, of our 88,004 contacts, 18,896 of them were related to suicide. We assess for low, moderate, and high risk using sort of a modified Columbia Suicide Severity Rating Scale, if anyone is familiar. And a smaller percent are actually individuals talking about their past suicide experiences or somebody that they have lost to suicide in their life as well. Lastly, of our 88,004 contacts, we had to call involuntary emergency services. So that would be calling for a welfare check without the caller's consent or without the individual's consent only 78 times, which is a rate we're super proud of. That means we have a 99.9% success rate with de-escalating crisis over the phone. And we're very proud of that. This graph, I don't know what happened there. It's supposed to have words. It's just a breakdown of all of the categories of calls that we answer. So the biggest portion is information and referral calls that or contacts that we take. So calls and texts that we are providing information and referral on, which would be looking for community resources or somebody has a question about a community resource. The next largest section would be listening and support, which is just somebody calling to talk about a situation that they're in, but maybe not in crisis yet. And then the smallest portion, about 24% of our calls are crisis intervention. Or when I say calls, I mean calls, texts, or chats. It's just hard to break that habit. We also have partners with different community agencies in North Dakota. And then some more about our care and support program. So the Care and Support Program was originally created to support individuals being discharged from psychiatric care facilities. So a short-term stay for acute care. And then oftentimes there would be this huge wait between discharge and maybe a follow-up therapy appointment. So this program would receive referrals from psychiatric hospitals. So we're partnered with Sanford, Altru, Prairie St. John's, and they sent referrals to us. And then 24 to 48 hours after that initial referral is sent over, um, we are reaching out. So this is a particularly high risk period of time for people being discharged. And programs similar to this have shown to reduce ER admissions or readmissions, ER visits, and suicide attempts. And so now that program has greatly expanded across our service area, and we now not only serve hospitals, but one-time therapy clinic, or not one-time therapy clinics, but like outpatient facilities, therapy clinics. Recently, we partnered with Grand Forks Public Schools, so now their mental health teams are able to submit referrals to us, and we reach out. Individuals can choose to be contacted weekly, bi-weekly, or monthly at whatever time is easiest for them. So if they work until midnight, that's okay. We can make that work. We have people here 24/7. It sets us up perfectly to be able to provide this support. And then we're building that relationship with them as well. So it's not so scary to call 988 or 211 in the future because they already know who's going to be answering the phone. Part of this program is also sending out these handwritten caring cards, like there's a picture of on the screen, just with an encouraging note and some resources. This is shown in a study as well to be a great reducer of suicidal ideation, which is really interesting as well. And there's some success stories that people have provided for us, basically just saying that they know that we're always here for them. So other kind of frequently asked questions about the Care and Support Program. Individuals can sign themselves up on 211 or 988. So we're going to offer this program for people with thoughts of suicide, thoughts of homicide, substance use, or anybody who just could use some more support in their life. We will sign up using our own internal referral process, but partnering agencies can also send referrals over in a system that works best for them. So some agencies will fax over referrals, some will send them using like their electronic medical system, but we'll set it up for what works best for that agency. It's free for every party involved, so participants aren't charged anything and referring partners aren't charged anything. It is covered through a state and federal grant that we have. And on these calls, we are offering listening and support, safety planning, or crisis intervention as needed. I actually saw a stat yesterday that we had pulled just for the year to date. And of our few thousand care and support calls, usually we have about 12,000 a year. So of probably the 6,000 calls that we've had for care and support so far, 119 of them were crisis intervention. So we're randomly calling this individual during a crisis, and we're able to help them work through it without them actually having to reach out to us because we're doing that lifting of making that phone call and taking that first step. Anyone can be on the program 14 and up. They can sign themselves up for it. Younger than 14, you just need a guardian's consent over the phone. And individuals can stay on the program for as long or as short of a time as they'd like. Some people stay on for years, some only need a few months of weekly calls. It's really just there to support the individual. If your agency at all is interested in being a partner of our care and support program and being able to send referrals over, I would love to hear from you. I'll have my email address at the end of this. So please send me an email and I will connect you to our care and support people to get you set up because it is such a great program that is really underutilized right now. These are some of our partners. And then these are the mental health trainings that we're offering. We have a lot of assists coming up. So applied suicide intervention skills training. That is a really in-depth suicide intervention training. So it's about 2 days of training that we're doing. and you're learning how to have that conversation and how to actually do the intervention yourself with somebody who's having thoughts of suicide. We're also offering a lot of suicide risk assessment trainings. Um, um, so that is using the Columbia Suicide Severity Rating Scale. I was just trying to think of who our sponsor is in Minnesota, and it has the Rethink Mental Health program that is sponsoring those. We offer those virtually every other month. So you can check out all of our upcoming trainings on our website, myfirstlink.org. And then this is my contact information. Does anybody have any questions for me at all?